For most Ugandans, asking for directions, reporting a problem to police, speaking to a health worker, or following a public announcement can take just a few words. For someone who communicates primarily through sign language, that same interaction can become a barrier. Uganda's 2024 census recorded more than 33,000 people with hearing difficulties, including more than 44,381 who are deaf. Yet, sign language interpretation is still absent from many of the spaces where important public information and services are delivered. For Alex Ogwal, that communication gap once had painful consequences.
Last year, during the elections, it was an evening, I met a group of army or the soldiers, and so they started questioning me of where I was going. Yet the fact is I was going home, so in that way I was using sign language and the army couldn't understand me. So in that manner they started beating me up. So when I went back home, I felt so bad.
Yeah, the recent elections we had challenges with access to information by deaf people, and we have engaged the responsible authority.
A graduate of social work and social administration from Makerere University, Alex Ogwal says the ambition is to make interpretation services cheaper and more accessible.
The time when we started building this app, we had one main reason, reducing the interpreter services. For instance, the time when deaf people go to hospitals, trying to search for an interpreter, in the first space, a deaf person has to pay 150,000 shillings to access an interpreter's service. In that manner, if a deaf person uses this app, that person will have a low budget towards the interpreter.
While an innovation is not a solution for people experiencing the challenge, Tukahira Rita, a sign language instructor, is excited about the innovation.
It is a technology, but again, it's not only that. It is an opportunity of accessibility. It uses communication. So many deaf people are blocked in communication. Inside the hearing community, so they're able to get and access, services. But again, when it comes to the deaf people, they can't, speak and they can't hear. In the banks, for instance, if this app is adopted, and also in the hospitals, if somebody is sick, they can just go to the hospital. If the hospital has that app, they're able to link with the interpreter if at all a problem happens.
However, issues such as confidentiality and management costs are a concern for some.
Uganda is a country that is still struggling with access to internet coverage, internet cost. The application, as far as I know, largely runs on access to the internet.
Ugandan law provides for the rights of persons with disabilities and recognizes Ugandan Sign Language, but recognition on paper does not automatically remove communication barriers. At hospitals, police stations, government offices, and during civic processes, such as elections, access to information can still depend on whether an interpreter is available.
Information is not completely inaccessible. Some information is printed. There are announcements, adverts, but since our deaf community, the biggest percentage has not been to school. We acknowledge there is need to translate information into sign language for the deaf. But also, we as Ugandan National Association of the Deaf, we have a 5-year strategic plan on the issue of ICT. Digitalization is one of the things in our strategic plan. We want to utilize Uganda's sign language.
That raises a bigger question. If young innovators like Alex can develop tools to bridge communication gaps, what responsibility do public institutions have to ensure accessible communications becomes part of public service delivery?
As we all appreciate, UCC's mandate, first of all, is to monitor access, universal access to available technologies, access to information, name it. I mean, sometimes when a deaf person wants to go to hospital, the person has to use a sign language interpreter because the doctors are not proficient in sign language communication, which makes it very hard for a deaf person to communicate directly with a doctor. So we would think that, and it's UCC's mandate to ensure that people with disabilities are given access their right to communication.
UNITE says it is also engaging government, including the Ministry of Gender, Labour and Social Development, around strong implementation of sign language access, with technology expected to play an increasing role. But technology alone cannot replace institutional responsibility.
In our plan, we want to establish an incubation center where different ideas will come together and innovations are given technical support, quality assurance and guidance before they are rolled out. For now, we have already begun collaborations with the Ministry of Gender. We are planning to establish some negotiations in Ugandan Sign Language. And ICT is a component within that, although we are also hoping for a law or act from Parliament that will help regulate sign language digitalization access.
For deaf access to grow, Alex will need more than downloads. The platform needs trained interpreters, reliable technology, safeguards for users' privacy, and sustainable financing. It could also create opportunities for qualified sign language interpreters by connecting them remotely to people who need their services. Alex has demonstrated what one young innovator can build. The bigger test is whether the systems around him are prepared to respond, because accessible communication should not depend only on whether an interpreter happens to be in the room.